Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Laser tattoo removal. Tattooing is an ever-increasing phenomena, which means the number of people who are going to get tattooing will be rising. Why? Because it became an accepted form of art, self-expression and beautification. How is tattooing performed? It is by injecting ink particles into dermis. These ink particles are of size of 20 to 400 nanometer. Because of this big size, macrophages which engulf them are unable to digest them and store them in lysosomes instead, which helps for its permanent nature. Once we get tattooed, it will stay with us for a lifetime because of this reason. And we are injecting it at a depth of 1.2 to 2 mm to reach the dermis, where fibroblasts will engulf and they will be staying there only, making the tattoo exactly the place where we inject ink particles to stay there only. What are the various ink particles? Carbon, which gives black color, azo and non-azo dyes. Metals like cadmium, cobalt, iron, zinc, mercury and titanium. All these are various ink particles giving various colors. Will be with the help of a needle, these ink particles will be injected into the dermis. So if we are injecting multiple times, there will be obviously inflammation. After this inflammatory process subsides, these ink particles lie engulfed in macrophages, fibroblasts and in between scar tissue, leading to its permanent nature and stability. Coming to types of tattoos, most commonly decorative tattoos, which may be amateur tattoos, which are done by human hands, professional tattoos, which are done with using a professional tattoo gun, which will oscillate the needle multiple times very fast, reducing the tattooing time, and it will inject multiple ink particles at a time in multi layers. It will be difficult to remove also. Why a person will get a tattoo? There may be various reasons: professional, cultural, religious and personal reasons. Next tattoo type is cosmetic tattoo. These tattoos are also known as permanent makeup. These tattoos are not dark in color, they will be skin colored or red in color. For lips, they will use a red colored permanent makeup, that is cosmetic tattoo. If we try to remove this tattoo using a laser, it will become darker. So we have to be cautious not to do laser for a permanent makeup. Coming to traumatic tattoo. While road traffic accident, asphalt and gravel particles may get inserted into the dermis because of superficial abrasions. During firework injuries, igniting particles may get entered and lead to a superficial tattoo called traumatic tattoo. It is easy to remove. And medical tattoo, which is done by doctors as a marker of radiation therapy. To know where to give radiation therapy, they will mark the area using tattoo, mostly carbon particles. At some point of time, many of them seek for tattoo removal as well. Why? Some professions won't allow any kind of tattoo on the body, so they want to get them removed. And for personal reasons like partner change, gods will provide partner to those who changes. Ironically, they will get new partner to replace the old ones also. Coming to proper topic, laser tattoo removal, which is the current gold standard technique with high degree of efficacy, reproducibility and safety. First we will see what are the contraindications. Then we can select a patient without any of these contraindications for removing tattoo using laser. Coming to absolute contraindication, photo-aggravated diseases like SLE. Here in relative contraindication, pregnancy, lactation, photosensitizing drugs like tetracycline, thiazides, isotretinoin. Isotretinoin has a property of increasing keloidal tendency also. Tattoo granuloma. Active infection over the treating area, that is tattoo area, like herpes or staphylococcal infection, or history of herpes. If there is any history of herpes at the treating area, we can give prophylactic acyclovir 2 days prior to treatment, during treatment, and 3 days post treatment also. If the person who is getting tattoo removal is tanned, we have to wait for 1 month without doing laser, because we are exposing them to laser light. If they are already tattooed with more melanin, it may absorb and lead to more inflammation, leading to post-inflammatory scars or post-inflammatory hyperpigmentation. For any kind of light therapy, tanned individuals have to wait for 1 month and get detanned using bleaching creams or sun protection. Unstable vitiligo and psoriasis. Why? Because of Koebnerization risk. Body dysmorphic disease. Whoever is having body dysmorphic disease, they will be obviously unrealistic, with unrealistic expectations and uncooperative. Patients suffering from seizures, suspected melanoma, livedo reticularis, erythema ab igne, gold therapy. While patient is on therapy with gold, those gold salts will get deposited in the skin. If they get exposed to sunlight or laser light, it will cause bluish gray hyperpigmentation of the skin, which is called chrysiasis. So we have to wait for at least 6 to 8 weeks after gold therapy to proceed with laser tattoo removal. Why? To avoid pigmentation. Coming to pre-procedure workup, for every procedure, whatever we do, we have to get thorough medical history, rule out neoplasms, especially melanomas, and any history of prior laser therapy and its response. Written informed consent after explaining each and every complications, side effects, procedure. Pre-treatment photographs. This is very important while doing laser tattoo removal. Those photographs have to be taken in same position, same angle, same background for every laser session. Why? Because to avoid medico-legal issues. Some tattoos after laser tattoo removal, scarring will become more evident. This scarring is because of tattooing, not because of laser tattoo removal. To have that evidence with us, we have to take photographs. Tattoo may conceal the scarring, and patient will think, I don't have any scar before laser tattoo removal. Now because of this laser I got scarring, which we have to prove wrong. If we have photographs with us for every laser session. I already told you prophylactic acyclovir therapy. Most important one is to provide wavelength specific protective eyewear to everyone present in the laser room, not only doctor and patient, to everyone who are present in the laser room. Priming. I already told you, if the patient is tanned, don't proceed for laser tattoo removal. We have to do priming first with sun protection and lightening creams in dark skin. Why? If there is more melanin, it will absorb the laser light and it will produce collateral damage, leading to more risk of post-inflammatory hyperpigmentation, scarring. To minimize these complications, we have to do priming for every light treatment. Topical EMLA, eutectic mixture of local anesthesia. what is this mixture composition? 2.5% lignocaine, 2.5% prilocaine under occlusion. Why? To avoid evaporation and to avoid wastage of our local anesthesia, which is costly. Test patch. We'll select a small area of the tattoo and we'll first treat it with laser and evaluate after 4 to 8 weeks how the laser is working, what are the optimal parameters to treat that patch, any complications are there. If it is a cosmetic tattoo, it will tend to darken on laser exposure, so we have to be careful. As a beginner, we have to always do test patch. These test spots will help us with medico-legal situations. Without assuring the patient, we have to do test patch. Then only we have to assure the patient this tattoo will respond to our laser, because the test patch is responding, so entire tattoo will obviously respond. Coming to various lasers: ruby for green, alexandrite, alex purple, teal, picosecond alexandrite, Q switch alexandrite, Nd:YAG laser 1064 for blue and black, exactly half the wavelength 532 for red color. Based on this, we will choose a laser and correct parameter. Choosing correct parameter is of paramount importance for any laser treatment. Here we will choose the parameters and laser based on skin type and tattoo type, T, A and D, not the average derma doc. Type of ink, amount of ink and depth of ink. Based on this, we will select a spot size which elicits immediate brisk whitening. That is nothing but frosting. And we will start with a low fluency. Then we will gradually increase. Why? To avoid blisters and pinpoint bleeding. At the beginning itself, if you use high fluence, there will be blisters and pinpoint bleedings. Frequency: if it is a small tattoo, less frequency is enough. If it is large, more frequency. Pulse width, we all know, it has to be equal to or less than thermal relaxation time of chromophore. What is the chromophore here? Ink particles. 0.1 to 10 nanoseconds. How many number of sessions are required? It is in between 2 to 20. Why this variation is there? Because some tattoos will respond fast, like traumatic tattoos, old faded amateur tattoos. But in professional tattoos, which they use multiple colors in multi layers, it will be difficult to treat. That's why here it is requiring multiple sessions, more number of sessions. Some colors won't fade. It will be difficult to remove. Some tattoos will leave a ghost image also. That is nothing but borders of the tattoo will be evident even if the entire tattoo is removed. What is the gap required for each session? It is 6 to 8 weeks. For what? To allow the clearance of ink particles by macrophages and lymphatics. I told you the permanent nature of a tattoo is because of macrophage. Now here again I am telling macrophage are clearing the ink particles. How is this possible? Because our laser light is targeting the ink particle and breaking it into multiple tiny pieces. Now this macrophage is able to digest and clear it. Lymphatics, through lymphatics. Coming to technique: by holding the handpiece perpendicular to the lesion, covering the entire area in one pass. Means one time, at a time, we will cover the entire area with pulses being placed close to each other with minimal overlap of 10% until frosting. That is nothing but immediate brisk whitening. Why it will happen? Because of rapid heat generated inside the cell, it will form intracellular steam, intravacuole formation, which will be clinically evident for our naked eye as frosting. If you see that, it is the end point for our treatment session. Pre-treatment and post-treatment cooling is important. Why? To avoid building up of heat and to prevent collateral damage, which will ultimately reduces the post-inflammatory hyperpigmentation. Pre-cooling is to protect the epidermis. Post-cooling is after the session. Anyway, heat will be built up in the tissues to remove that excess heat without damaging surrounding tissue. That is nothing but collateral tissue damage. Gunpowder and firework tattoos need more care as the implanted material has potential to ignite, resulting in pox-like scar. This is nothing but we are cracking the crackers inside the body using laser light. To avoid that, we have to be more careful. Coming to mechanism of action, main principle, selective photothermolysis. By using thermal relaxation time, exactly that of chromophore, and we are targeting selectively. Apart from that, photomechanical effect, that is photoacoustic effect. This laser produces vibratory waves or shock waves that cause micro explosion of the target. Hence, an audible popping sound is heard with each pulse. So, if we are hearing an audible popping sound, we are doing the laser correctly. Because of micro explosion of the target, using the laser, we are exploding the target into multiple tiny pieces, which will make a macrophage easy to remove and easy to clear via lymphatics. Coming to complications, allergic reaction to certain ink and topical amla. Already the patient got tattooed, now why he is getting allergic reaction? Because while exploding the tattoo ink particles, it will create an environment of similar to that of tattooing and may cause allergic reaction now. Acute compartment syndrome. This is rarely reported in upper limbs for a professional tattoo. Darkening of cosmetic tattoo. Already told. Any light is a energy which will cause burns, blisters, pain, petechiae and purpura, textural changes, keloid, scarring and superficial infection. Because we are generating heat, photothermolysis, this heat may cause all these complications and may induce inflammation, leading to post-inflammatory hyperpigmentation, which will resolve with time and easy to treat via bleaching agents or lightening creams. But post-inflammatory hypopigmentation will persist for months and difficult to treat. Various treatment options are phototherapy, topical tacrolimus, pimecrolimus for post-inflammatory hypopigmentation. Coming to post-operative care, sun protection. I already told you, don't proceed to laser if the patient is tanned. So for next session, you have to make sure the patient is following priming, sun protection, avoiding sun and avoiding cosmetics throughout the treatment procedure. Ice packs, nothing but post-treatment cooling. Why? To remove the excess heat till the burning sensation reduces. Topical antibiotics till the lesions heal. It will take 5 to 10 days to heal. Coming to limitations, ineffective removal of some colors. I told you some colors are very difficult to remove. Incomplete clearance, tattoo resistance. What is meant by tattoo resistance? Even after adequate number of sessions, tattoo was as it is not removed. Long duration of treatment. Why? I already told you, we are allowing the macrophage to clear 6 to 8 weeks between each session. Overcoming all these limitations and reducing complications, newer techniques like R20, R0 and combination of lasers like fractional laser with Qs which they have developed. Coming to R20, R means repeated exposures, that is 4 treatment passes with a gap of 20 means 20 minutes. Just 20 minutes. This 20 minutes is to allow the clearance of bubbles. Why? Because of intracellular steam. This is safe in fair skin but have more adverse effects in dark skin. What is the limitation for this R20? Long waiting period of 2 hours. 2 hours is also long for both patient and doctor. So overcoming this limitation also, they have invented R0, repeated exposures with 0 waiting period. How is it possible? By applying perfluorodecalan. Immediately after laser, it will dissolve all the gas bubbles, thus opening optical window, which means making the skin ready to receive another laser session immediately. Here we are waiting 20 minutes. Here we are using perfluorodecalan and making it to 0 waiting period. Why? It will dissolve all the gas bubbles, thus opening optical window. Remember the channel name TADD. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.